Hi everyone, my name is Tushar, and today I'll be taking you through a day in my life. Now, a little bit about me before we begin. I'm a third-year medical student studying at Monash University, and as part of my curriculum, I get placed at a hospital site for the entire year. And this year, I've chosen to be in a rural town called Mildura, which is located just at the edge of Victoria, New South Wales, and South Australia. Now, it's 6:30 around about right now, and I'm just getting prepared to go to hospitals for my ward rounds. And obviously I'm going to have to carry the essentials, my laptop, my clipboard that'll have all my patient information and files, and lastly, of course, my stethoscope. I'll see you all at hospital. So currently I'm on a surgical rotation. I'm on general surgery. The ward rounds for that start really early in the morning. They start at 7 a.m, which is why I'm driving there right now. But obviously the best part about living rurally is A, the hospital is only 5 minutes away, and B, there's absolutely no traffic lights. All right, so we're starting our sim session now. Lila, do you want to explain how this works?
So we go into this room with like a fake human being that can like breathe and talk and has a heartbeat and lung sounds, and so we act out real scenarios. So it helps us practice for the hospital. It's really good.
So Jackie, are you ready to save lives?
Woo!
Yeah! All right, I've finished my sim sessions now. It's time to practice OSCEs with Katrina. So OSCEs are kind of like our little clinical exams. And since it's exam season, we've got to get cracking. Post-op complications with Sam, obviously. Are you excited for the Sam?
Yeah.
I'm not. Anytime you have free as a med student, you've always got to grab one of these. Because in rural towns, there's always a shortage of healthcare professionals. As students, you're required to do a lot of the roles that some of the senior members of the healthcare team would do in the city. So for example, as a third year student, first day in, we got chucked into the deep end, got handed the patient notes, and we were required to write. Second day in, we were already required to take bloods and put cannulas in. Third day in, and you hear a lot of the students already starting to assist with some of the big surgeries with the surgeons. So as a student, you get to do a lot. You get to be really part of the team, not just an observant, which I really enjoy about Mildura. And now I reckon it's time to get some clinical practice done. So the great people in Mildura love to put out all the equipment we need to practice all of our medical skills, and the lab is always open for us to use. So something that I really need to practice is my Vita punches, and you guys can watch. And that is how you're collecting blood. At night, part of my study regime involves trying to cover a lot of the topics that we're required to know for our exams, obviously for third year, but at the same time correlate that with stuff I've seen in the hospital today. When I study the condition, I'm not only prepared for the exam, but I also know what the other doctors will be talking about when I go into hospital tomorrow morning. And I'll also be prepared for scary questions that they might ask me tomorrow as well. Thank you so much for following me around during my day. I hope it was interesting and you got to learn something new about year 3 at Monash Medicine. And yeah, hopefully I'll see you guys around. Thank you. Bye.